grew up with a mission to serve. My father was an immigrant. My mother was an immigrant. I entered into the education process, always had the resources, since that's an important word, to be able to see the end point for a period of time and then move on to the next. So I had the unique opportunity of getting educated in different disciplines: agriculture, engineering, medicine, public health, and to a limited extent, the media. With that, I've had challenges. In the 70s, I had a major challenge to be a part of a new institute in the U.S. government, the National Institute for Occupational Safety and Health, NIOSH. And we go 50 years later, here I'm trying to create another new institute. So things go in circles. I've had a lot of opportunities in different areas of health and healthcare. Some have been success stories, and some could have been better off. And this has been all throughout the U.S. I've visited almost every state in this country, interacted with people. And this came about later in life when I was not chosen to be U.S. Surgeon General. Stanford asked me to join their faculty, both in the Center for the American West, the Bill Lane Center, as well as the med school. And they launched me on a project in Santa Fe, New Mexico. So once again, the circle of life goes around. So 4 years later, I'm going back to New Mexico. In this process, we did a major production on rural health in Salt Lake City. And because of the movie The Providers, that connected me with Matt. Over time, we were going to interact, but the opportunity over the last couple of years didn't find a convergence between Matt and I. And then most recently, when the senator of New Mexico became the lead sponsor, along with Anna Eshoo, the congresswoman, for my vision of a National Institute of Rural Health, that reconnected with Matt with an interesting little story. Matt and the senator went to the same high school, slightly apart in age, but they know each other their whole life. So that's what's reconnected us to go. And the other thing that reconnected us very strongly is that Matt and this other group, the 100% community, which is he a part of, really has one of the few success stories, empathetic success stories with data. And I think that's mission critical. If you don't have a story that other people can relate to on their terms, then they feel that you're too far out of the box. As a famous former president of Stanford said, our whole world's about money and data, or data and money. And unless we have the right data that we're doing things to show that there are appropriate outcomes for what we set the metrics that we're going to measure before we get started. We might tweak them or pivot them, but we really have to have not only artificial intelligence or augmented intelligence, we have to have information that has impact and that makes a difference that can be related to. Because in the healthcare field, there's no shortage of data, but who has access to it? Is it transparent? Is it trusted? And is it understood by one and all? That doesn't mean it can't be packaged differently, but we really have a time where technology has taken over our society, good, bad, and indifferent. We have to make it as a major, but only part of the solution. And we have to have interactions on a more humanistic basis that we're all treated with dignity and spirit.